Now, when Finance Minister Ken Ofori-Atta arrives in Parliament tomorrow to present the country's mid-year budget review, the entire nation will be glued, waiting on him to roll out his measures to deal with the slump in the economy, fueled mainly by the coronavirus pandemic. Businesses have gone down. Many have lost their jobs. Entire industries and tourism, showbiz, even church activities have been hit hard. Simply put, the country's revenue flows have dwindled whilst expenditure has just gone up as government doles out more relief money to electricity and water consumers, support for vulnerable groups as well, among others. How will Mr. Ofori-Atta shore up the revenues and reduce the expenditure to bring the economy to some stability? And that's his headache as finance minister. But whether he gets it right or wrong, you and I will be at the receiving end. Mind you, we're in an election year, and whatever decisions he makes tomorrow will have that firmly at the back of his mind. On the pulse today, we have put together all the experts to help us make sense of what's happening around us and how tomorrow's review will affect each one of us. We have experts in health, education, social protection, and the economy. We'll also take you to the streets and into Parliament for perspectives from there. A packed show here for you. First, though, a report by Joseph Akable looking ahead to the review.
Ghana, like many other nations on the globe, has been badly hit by the fast-spreading COVID-19. Restrictions were imposed to contain the spread of the virus, with people urged to remain in their homes. Making ends meet became extremely difficult. Various sectors of the economy suffered as a result, with players calling on government to intervene. The aviation and the tourism industry were badly hit.
It has the potential to put a lot of hoteliers out of business.
Really?
It has the potential to collapse businesses.
Can you explain to me why?
You see, the hotels thrive on occupancy. We thrive on guests coming from outside and inside as well to lodge at their place, so charge them room rates. And then they also eat food, they drink, and for some recreational purposes too, they use your spa, your swimming pool, and so on. Now, so when these guests are cut off, then the oxygen that feeds the business is also truncated.
Yes, airlines, tour operators, and everybody is telling us the impact that they are facing in their subsector, if I should put it that way. And what we are trying to do with the data is to put it together and then present it to the Ministry of Finance, central government, on ways that we can mitigate. But so far the situation looks pretty bad. I mean, we've had load factors on airlines dropping to beyond below 40%. It used to be 60, 70. Hotels are telling us that the occupancy is dropping from around 65 to 70 to 20% and all that.
Finance Minister Ken Ofori-Atta is concerned.
We've cut down, maybe if you look at our budget for travel and seminars and whatever, of some 93 to 43, maybe it was about 200 or maybe $330 million CDs. I think we've spent about 93 million. Anyhow, we have over 140 million CDs left, of which we are not going to use much. So you begin to see what type of savings you have if we were to digitalize the economy so that we can do much more together and also get our educational system.
The mid-year review and supplementary budgets expected to address some of these challenges.
We as a country, seeing what we have been able to do these 6 months compared to our neighboring countries, is really to sit up and say, okay, how do we even build this resilience to be stronger? And I think we should do something about digitalizing the whole economy, such that access to data is much cheaper, that given obviously an online system for education is now much clearer to us, and that's the infrastructure we must build. Look at our healthcare system and the president's bold move for agenda 88 or 100 hospitals or so that we have to do to tackle some real intractable problems that we have. We don't have unemployment benefits in a system like that, so now it comes front and center as to what we do about that.
Is it something that you consider honorable?
Yeah, I think all of those things for a responsible society should have them. And maybe this is a time to make the bold move for things of that nature, so that, you know, everyone is taken care of. And an incidence of something like this, the issue of unemployment, etc., would have been catered for.
Only time will tell how the economy, once touted as part of the fastest growing, will bounce back to life.
Joseph Akable with that News Desk report. We also have a report looking at vulnerable groups. We'll bring you that shortly. But let me welcome my guests to the conversation, and all of them are joining us via Zoom because as we observe social distancing necessitated by the spread of coronavirus, this has become really necessary and really the new norm. I have HOMADZI, who is interim chairman of the Ghana National Education Campaign. Joseph, I beg your pardon, Joseph Achu HOMADZI is the interim chairman Ghana National Education Campaign Coalition. Mr. HOMADZI, thank you for your time this afternoon. Good afternoon. I think you are muted, so if you will unmute, then I can hear you. But let me also introduce CECILIA SENOO from Non-State Actors for Health and Development and Executive Director for Hope for Future Generations. Madam SENOO, good afternoon to you. Okay. I do have Dr. Joseph Obeng, the National President of the Ghana Union of Traders Association, GUTA. That's the umbrella body of Ghanaian traders. Doc, thank you for your time this afternoon as well. Okay, I'm going to start with Mr. HOMADZI. Mr. HOMADZI, thank you very much for your time once again. So, what really are the areas of interest to you? I'd like for you to think of this for me whilst I come back to you for that answer. Let me bring in this soundbite. Yesterday, Deputy Health Minister Dr. Bernard Okoboy was in Parliament and he was addressing concerns relating to the challenges brought on all of us by the coronavirus pandemic. Listen.
The claim that government had refused to pay contact tracers also qualifies as an inaccurate narration, composed to create the impression that contact tracing has been abandoned. As a speaker for the records, the Ghana Health Service recruited volunteers who were about 2,000 in number during the 3 weeks of lockdown to help trace and test the 30,000 plus travelers who entered Ghana before the airports were closed. The assignment for these volunteers was to last for the period of the lockdown. After the lockdown was lifted and most of the travelers traced and tested, the Ghana Health Service instructed districts to discontinue their engagement with the contracted contact tracers and revert to the use of their community health nurses for the purposes of contact tracing. These trained outreach staff, who were on government roll and are still on government payroll, took over the task of contact tracing, which they have been doing till date. The contracted provisional contact tracers had a defined assignment within a defined period, and government has indicated its commitment to honoring its part of the bargain. I am happy to mention that 6,000 health workers that were vetted and validated as having been in direct management of confirmed COVID cases have had their 50% basic salary for the month of April hit their accounts.
That's the Deputy Health Minister, Dr. Bernard Okoboy there. Let me bring the conversation to a start. Mr. Joseph Achu HOMADZI, thank you once again for your time. So let's focus on education with you, since you're representing the the National Education Campaign Coalition. What are your expectations for tomorrow?
Thank you very much, Madam, and good afternoon to your viewers. Our expectation is that, you know, the COVID has brought a change, a paradigm shift in terms of our life. This time around, the COVID has changed a lot of things for us. So our expectation of area will be in education. Now you notice that the traditional learning in the classroom has gotten a different dimension. That is e-learning programs now. So I will expect the budget to cover that area of e-learning to the extent that the government will put a lot of money into the buying of laptops and tablets for school children, because now we want to encourage e-learning. Now you see some of the schools are doing even the examination online. So this is the dimension education is taking now. And I think the budget must focus on that area and cater for the needs of e-learning of the children, so that when the government buy laptops, tablets for children in the rural areas, we're also talking about training of the children. Even the teachers must also be trained in that area, so that they'll be computer literate and be able to help the children, because we have to embark on the e-learning program now for the children. That's one area. The other area is...
If I would just engage you briefly on this first area that you've mentioned. You talk about rural, assessing people who are in the rural areas. That's a big problem, because first of all, we don't seem to have the internet connectivity across the board, especially in rural areas where we can reach out to these children. And then you talk about provision of laptops and tablets for the children across the country, and then training of teachers. Should all of these go together, or do you think there's a particular one that must come first, and why?
Well, since this is just a review budget, because this is not the actual budget, so you don't put too much burden on it for now. Okay. But progressively, I think that should be the case. But for now, as we are asking, if you ask me, I would suggest that the laptops and the tablets should be bought first. Okay. Because if you don't get it, how do you do the training? So when we get them for the children, then the training can follow. In that order.
With your experience in education, is this realistic? I mean, in education in Ghana, is it realistic for government to be able to, supply tablets or laptops across the country to the thousands of children?
Well, yeah, I will. You see, but this project has been there ever since. That's why the various governments have promised that they will provide students with laptops and the tablets for learning, and COVID has just created that awareness now the more, because it has never been there. Previous governments have been discussing it, that we should provide laptops and the tablets for Ghanaian children so that we can enhance their ICT skills. And now it is obvious that we need it. So I will not say everything should be done one day, but it's a gradual process. We should start from somewhere. Even right now, like I said earlier, some schools are doing online learning, online examinations. So it's just a matter of enhancing it and expanding it gradually.
All right.
Because that's where globally the focus is now.
Okay, brilliant point you make there, Mr. HOMADZI. Let me bring in CECILIA SENOO. CECILIA SENOO represents the health sector for us. She is, representing non-state actors of health and development. She's also executive director for Hope for Future Generations. Madam SENOO, thank you for your time. So for you from the health perspective, what are the key issues? What matters to you most?
Okay. Thank you very much. Good afternoon, and good afternoon to your listeners. Yes, for us at the health sector, and for that matter, civil society, we are looking at stronger health systems and health services to the vulnerable in society, especially women, children, and young people, where access to services will be closer to them. I will talk about children because of immunization. I think COVID has taken over a lot of our health issues, and the focus by everybody is looking at COVID. But other health problems are suffering. malaria is rising. HIV, people are not able to go for their drugs, and those who are even going, we just got to know that there is a potential shortage of ARV. We don't have test kits to test for HIV. And so we are looking at the government looking at areas that are also very important.
Can you pinpoint some of these areas? I mean, I know you work in most of these deprived communities. So the key issues regarding health in your area of operation will be what?
Yes. Thank you very much. We looking at where we are coming from as civil society. You know, pregnant women are also vulnerable and they are most affected.
Right.
And because everybody, the frontline workers, everybody is focusing on COVID, antenatal, postnatal, and care of children is happening. That's what I'm trying to say, that our attention has been shifted. And if we have more health workers who are at home, I would expect that there should be adequate resources to employ more health workers, more midwives, who will focus attention on women and children, and also look at preventive health, so that all our attention shouldn't just be on COVID.
Okay, that's great.
Yes.
Is there a specific intervention that you want to hear from the finance minister tomorrow when he goes to Parliament to present this, to do the mid-year review?
Yes, we are the civil society, non-state actors. We want to hear more on plans that the government will put in place to respond to the needs of the vulnerable people in society. Okay. I mentioned them already: women, young people, people living with HIV, and also to cushion them when it comes to their medication, their nutrition, and also invest more into preventive health. We want the government to come out clearly on partnership with communities in addressing health. We also want to hear a lot of resources going into health and monitored, not just going under health, because we are looking at stronger health systems, and also more resources to the lower level, you know, the sub-national level, not only national level, so that the vulnerable in society who are not at the national level can also benefit and have that stronger health system that we are all looking at.
Okay, I'll come back to you so we can wrap up our conversation. By the way, I was supposed to be joined by Dr. Joseph Obeng, who will be representing, you know, the National Union of Traders Association for us in this conversation. He's not joined us yet. I'm going back to you, Mr. HOMADZI, and I want you to, you were mentioning a second issue. You've talked about the the digitization of education, which is one of the things that the minister spoke about in that interview that we played earlier. He talked about the sort of infrastructure, infrastructure that will support education, health, etc. What was your second point, Mr. HOMADZI?
Yeah, thank you very much. My second point will be classroom infrastructure. Not necessarily for this particular review, budget review, but progressively as we are moving ahead, because we are told the COVID has come to stay for a while, maybe 2-3 years' time. So there is the need now, because we are talking, one of the protocols we have to observe strictly is social distance. So we are thinking that moving forward, this budget, this review, and the subsequent budgets should cater for expansion of classroom facilities. And for that matter, dormitories for the senior highs and even the universities, so that we can practice and strictly observe the social distancing in the classrooms and the dormitories. So the second point I'm making is that the serious attention must be given to construction of classrooms and dormitories, etc., etc. And then even the toilet facilities, urinal, etc., etc., so that the children can observe the social distancing and serious hygienic, health hygienic protocols in the schools, so that we can protect the children from contracting this disease. Okay, so that would be my second point.
Right, and so expansion of school facilities and sanitation. is the point that you make. I just go around to with my very final set of questions to you. Madam SENOO, are you still there?
I am, please.
Right. So I know that you work a lot with young people. What comes up in the conversations that you have with them? Do they have expectations at all in times like these?
Yes.
What do they share with you? What kind of what do they say are their expectations? For example, when it comes to listening to the finance minister with a whole lot of words, what are their thoughts when you engage them?
Thank you very much. The many young people that we work with as civil society organizations are expecting the government to invest in creating jobs for them, because many of them have finished and they are at home. They are still depending on their parents. And you know, the expectation of young people who are also part of the citizens of Ghana must be met. And so many of them are at home. And again, we are working with a lot of young people living with HIV and a lot of young people infected with TB. I think currently we are facing a potential shortage of ARV. So there's a lot of fear and panic because, you know, it's antiretroviral drug is a life-saving drug for them. Today, a meeting that we had with them, many of them are afraid that the shortage will affect their health and they might die. I think this is something they are looking at, that the government should invest in their health, to invest in the commodities that are life-saving to them as young people, unfortunately infected with HIV. They are also expecting the government to meet their needs as young people and vulnerable in society, including young people who are also disabled. And so tomorrow we want to hear something that will cushion and support the life-saving drugs of persons living with HIV and TB in society, and for the government to meet its co-financing to ensure that essential commodities for health are available at all levels, especially the lower level and sub-national level.
Very well. I'm sure that by tomorrow we'll be able to get through to you so we can assess your level of satisfaction with what you hear as against what you've just said. But Mr. HOMADZI, let me take your final words on that.
My final word would be that on behalf of my coalition, we want to wish all the students who are taking the exam, the final year students who are taking the exams currently, the SHS 3s. We wish them well in the examination. We are praying that the good Lord will sustain them and take them through successfully. They should discipline and not get involved in any financial examination practices. We are also asking the school guidance and counseling coordinators in the schools to be counseling the children during this time of COVID. Because as it is now, sometimes there may be some anxiety on the part of the children. So we are asking guidance and counseling coordinators.
Looks like Mr. HOMADZI froze all up on me, but his point has been very well noted. He's interested in digitizing our education, as the minister said, but he's looking at provision of laptops and tablets for our students across the country. He's looking at reaching the hard-to-reach areas with internet accessibility, expansion in our school infrastructure, as well as sanitation. Those are the areas of concern for him. We also heard from CECILIA, SENOO, who was representing non-state actors for health and development. She's also the executive director for the Hope for Future Generation. Meanwhile, Mr. Joseph Achu HOMADZI, who we just lost, is the interim chairman for the Ghana National Education Campaign Coalition.